Obesity is a chronic disease with dire consequences for our health. This is a trending topic, but few people understand the possible consequences of rapid weight loss, whether it's because of bariatric surgery, medicine-induced weight loss, or over-exercising. Weight loss exacerbates the signs of aging, especially in the face, and it can be exceptionally hard to treat. So we have taken a patient with severe volume loss in the face due to a combination of surgery and over-exercising, endurance exercise, and we're going to share his journey. So in Joe, we see the classical signs of rapid weight loss. In the temple area, we see severe hollowing, as well as volume loss in the mid-face, and that's creating this pronounced nasolabial line. As well as the sunken eyes, it's also giving him the distinct laxity in the skin, as well as the lack of adherence. So we need to understand that the skin is made up in 3 layers. The outside, which is the epidermis, then we have the dermis, and just underneath the dermis we have the hypodermis. Structures in the skin are so important, not only for protection from the outside, but the fatty layer of tissue called the dermal white adipose tissue that sits just under the skin forms part of your immune system and is also responsible for producing hormones like estrogen and testosterone, which is incredibly important for skin health as well as the barrier function of the skin. So we're going to start addressing a combination of factors with one product. And for this, we're going to use the regenerative biostimulator called PLLA-SCA, or the brand name for that is called Sculptra. So Sculptra has been on the market for more than 25 years. In South Africa, we have been using it for the past 4 years. It's the first of its kind when it comes to biostimulators, and it has an impeccable safety profile with hundreds of studies showcasing its effectiveness as well as its safety profile. Recently, we have started to do some research on its regenerative capabilities. And here we see that it not only affects the dermal white adipose tissue, but it's also responsible for gene expression, which enhances elastin, it decreases pigmentation, as well as works on your immune system, as well as the hyaluronic acid and extracellular matrix in the skin. It truly is a unique product that addresses all signs of aging in the skin, from sagging and laxity to a glow and luster of the skin, as well as natural volumization. It's long-lasting, and what I find is one of its biggest attributes is that it's natural, it's biocompatible, as well as biodegradable, breaking down into water and carbon dioxide. So, Joe, are you ready for your first treatment? Okay. So, as I mentioned, this product, Sculptra, addresses so many conditions. So if we take a look at the severe temple hollowing that Joe has, Sculptra is going to start addressing that. You will see an immediate volume change as we do the procedure, and I'll show it to you now. And the effect that restoring volume in the temple can have on restoring facial harmony. Sculptra is reconstituted with sterile water, so it gives us an immediate volumizing effect. The water is there to suspend the particles of poly-L-lactic acid, which is actually what's responsible for the effect. The water will reabsorb over the next 48 hours, and the patient will almost look exactly the same as they did before we started with the treatment. So Joe, you're going to look a lot younger now because of this volume, but over the next couple of days you will return to almost the same state as what you had before. And I'm going to do half of a face, just show you the effect of restoring volume on facial harmony. So you can see that I have changed my direction and I'm starting to work a little bit in the mid-face. I can see Joe flinching a little bit. Joe, is it stingy?
Just a tad.
Okay, so the product, when we reconstitute it, contains a little bit of local anesthetic, lidocaine.
Oh.
And it's the lidocaine that stings. So it's just there to make you a little bit more comfortable, but I think you have to agree that it's not a continuous discomfort.
It's not.
Okay. So at the moment, I'm working with the product to restore some of the volume lost here in the lower part of the mid-face. It's going to not only address the nasolabial lines, but it's also going to address the quality of the skin. The wonderful thing about this product is that we can also restore some definition and even projection of the bony areas. And by using it correctly and placing it properly, we see a phenomenal change. And this is specifically, I think, a beautiful product to use in patients who want a natural look that's long-lasting and don't want to look as if they've had a lot of treatments done. And you will see this now when I get Joe to sit up. I think we can already see just how restoring the volume changes the harmony of the face. Joe, I'm going to show it to you. Take a look in the mirror.
Sweet. Oh, okay. I can see that now. Yeah. There's volume in there and there's volume around here. Yeah. Very different.
So, if we take a look, we can see volume loss, sagging of the skin, and by restoring the quality of the skin and volume, which we're going to continue doing using tissue fillers in the Restylane range to give us that appearance over the next couple of months.